Joining us now is infectious disease specialist, Dr. Niel Rau. Dr. Rau, how far wide is this thing going to spread?
It's going to be all over the world, Dan, and this is the whole problem with this pandemic term. Pandemic means you've got a virus, which is new. It easily spreads person to person, and then it ends up all over the world. But the piece of this that I'm still grappling with is just how dangerous is this virus? Because if I work by analogy here, Norwalk virus is also very contagious. Every year it's a new virus. It goes all over the world, but we don't get scared when we hear of a Norwalk pandemic because Norwalk doesn't kill you. Now, I'm not saying this is just Norwalk, but it certainly is not bird flu, avian flu. It's not the Armageddon virus that everyone planned for in the pandemic plan. And I think what's starting to happen here is the WHO and CDC have spent so much time planning for a pandemic that they've decided we've got to have one without thinking about the nuances of how things may turn out in terms of the virus itself. Maybe the virus doesn't kill such a high percentage of people as they had planned for in terms of pandemic planning. And I'm not even going to say maybe, I'm saying I'm pretty darn sure, because we've seen this virus in North America now for 2 weeks, and we haven't had a single death in Canada or the US.
Well,
it's the same virus as the Mexican
no
virus.
Why have we had no deaths and there's been 160 in Mexico?
My personal bet is this virus has been circulating in Mexico for quite a few weeks. It's very contagious. It has infected many, many people. And then finally, the rare unlucky person gets severe disease, and that unlucky person is not the typical person who dies from seasonal flu. It's someone who's young and healthy. So that startled everyone. We got worried. We've got a killer virus that takes out young people. We started thinking 1918. But then as you start watching this disease spread through the world, and you look at the spectrum of disease, most of it's mild, and it's kind of a double or nothing. You know, double or nothing. You either get really mild disease, and perhaps rarely you get deadly disease. I'm still waiting for us to find it up here. As we keep watching, those of us in hospitals can be very excitedly watching. We should watch. We should test them. We should give them antivirus treatment to try and save their life so that we don't miss them. But for the rest of the world, it's mild disease. We are chasing a disease that is comparable to the common cold for the most part so far.
How do you
we need to watch it. If it gets worse, if we start seeing more severe disease, then we can ramp it up. But we don't have to create this calamity.
What treatment is available for this?
Well, there's no treatment for mild disease that's warranted. Now, if we're dealing with somebody in the hospital, we know this virus responds to those antivirus medicines like the good old-fashioned Tamiflu, or there's an inhaled one called Relenza. And typically, doctors don't give antivirus medicine to patients with severe pneumonia because they don't think to test for flu. During the flu season, we're a little bit better at that, but that's not common practice. When we treat people with bad pneumonia, we use these antibacterial drugs, but we don't use the antivirus drugs like Tamiflu. That paradigm is probably going to change. But again, this is a doctor's story now. This is not a public interest story because most people are getting mild disease. And as every single day goes by, Dan, I can rest easier and easier because we have so many people who have been potentially exposed to this virus in Canada and the US, and none of them are dropping dead.
So when you say this, we're looking at pictures of what's going on in Mexico. People are walking around with masks on their face. People in airports have masks on their face. Are they overreacting?
I actually think so. But I know it's a bold move for me to say it, to be bucking the WHO, but I think they should really get a hold on the seriousness of the disease that this virus causes by looking at the experience elsewhere if they can't figure it out in Mexico. And we really got to end this war, because the other thing that's happened is that they did not declare a level 4 on Sunday, which might have been appropriate while they were investigating it. And now that they've found there's more human-to-human transmission, they've ramped it up to a 4 without taking into account that the virus is probably not that deadly. So all that's gone on here is that the wave just got bigger. Everyone got even more concerned that we're on the verge of Armageddon. But we have no proof that this is actually that dangerous. And we're not seeing mass casualties, huge numbers of people coming into hospitals with pneumonia, flooding the healthcare system. We're not seeing daycares being closed. We're not seeing absenteeism from work. We're getting sporadic, serious cases reported in a population, a huge population of people that has been exposed to this virus. So no surprise.
Just so I'm perfectly clear on this, though, you're saying that it won't happen, say, in Canada and the United States because we have the forewarning and will contain it.
No, we won't contain it. It's already out of the barn. The horse is out of the barn. You
all
cannot contain
excuse
flu.
me, Dr. Rau, but if it's out of the barn and it's going to come here too,
Yes.
why won't it kill hundreds of people like it's doing in Mexico?
It probably will over time, but we're talking 100 out of millions. If 100 out of 100 million people die, that's not a very exciting story. If 100 out of 100,000 die, that's a more concerning story. The number of people who have been exposed to this virus in Mexico is probably much greater than we first appreciated. And on any given day here in Canada, because the virus has already arrived here and it's also in the US, more and more people are being exposed to this virus and no one is dropping dead. How come? That's what we have to, to me, that's incredibly reassuring. I'm not saying we have no problem. We've got to watch this at a hospital level, but I think our level of alert and panic needs to drop immediately. Every day is one notch less a level of panic, in my view.
Dr. Niel Rau, nice to see you, sir. Thank you.
My pleasure. Thank you.
Right now, a short pause. You're watching CTV Newsnet.
A global swine flu outbreak. Healthcare officials on alert. Hundreds infected around the world. And it's spreading. What do you need to know to protect yourself and your family? For all the latest on the swine flu outbreak, watch CTV Newsnet.
They are all being described as mild. That now brings the total of new cases in Canada to 7. Once again, let's bring in our infectious disease specialist, Dr. Niel Rau, who has been listening along with us there. All these cases so far, Dr. Rau, are being described as mild. What does that mean? Does that mean that no treatment is being given to these patients?
Yeah, absolutely. If they have mild disease, there is no point to their getting treatment, because giving an antiviral medicine to someone like that won't do much to shorten the duration of the illness. It might somewhat decrease the spread to close contacts, but we already know that many other people have been exposed to them anyhow before they got sick, and we're never going to be able to contain or prevent the spread of this virus. But the operative word mild is very reassuring. It keeps coming up over and over again. So far, after 5 days of observation of this new virus since Friday, we have heard of only 2 serious cases now under investigation in California. Not even confirmed, but let's say they are the real thing. Considering how many people have been exposed to this virus and how many days we've been observing for the consequence of severe disease, this is extremely reassuring that this virus is not uniformly deadly. Based on the prior press conferences we listened into from the CDC, what is unusual here is that the virus seems to affect young, healthy people very severely, but quite rarely. And that's unusual from another flu virus, the typical seasonal flu. We need more information, more observation, more studies. I think the big challenge now for Ontario and for Canada is to try and pick out these patients who rarely do come down with severe disease at the lab level. And now, as a microbiologist, as well as an infectious disease specialist, I'm focusing a bit on the lab side because I think we have a vulnerability there depending on which province you're in. If we use those rapid tests that they use in community hospitals, we're only going to pick up 60 or 70% of cases of flu. There's a more sophisticated technology out there. It's costly. It's a big investment. It's called PCR. It's the wave of the future. It'll pick up other respiratory viruses. And I think this is a sentinel event which leads to the need for us to have better diagnostic capabilities so that when we have those serious cases, we can step in there, find them, and treat them and potentially save their life.
Do you think this is just a matter of timing? Are we getting to these cases earlier and sooner as opposed to the severe cases that we saw in Mexico? Is that the reason why we're not seeing these severe cases?
Well, first of all, if we didn't know about Mexico, what would have happened is that we would have waited quite a long time as this virus made its rounds, and then some astute physician would have gone, whoa, I've never seen such severe flu in someone who is 16 or 18. And they would have sent a test, and then finally we would have figured out it was a new flu virus, all right? What is going on here is that as people are looking, they are finding. So each day we're going to have a proliferation of cases. People who otherwise would not have been tested for swine flu are now being tested. So the numbers will blossom worldwide. This will look like a massive outbreak, but you have to keep in mind that people normally don't test as aggressively for flu as we are testing for swine flu, so each day the number will continue to blossom. What I'm more interested in is not the total number of cases, but the number of severe cases, people needing to go on a breathing machine, people needing to be admitted to hospital, and then people who die. And how different is that from seasonal flu? That's the question. We can already stand down a little bit on this virus because it looks like it's rare to have such serious outcomes. But what's interesting to me as a physician is that we now have a flu virus that behaves a little differently from seasonal flu in terms of who it picks off rarely.
Infectious disease specialist Dr. Niel Rau, thank you for listening in on that news conference with us.
My pleasure, thank you.
Quick recap again.